Hi, my name's Micah and I am a registered dental hygienist. As a senior in high school, I took a career class, and in that class we shadowed multiple professions that we were interested in possibly going into. It was at that time that I chose dental hygiene as my career path, based on several facts that I knew about the profession. Some of the things that I knew were what my typical schedule would be like. Most dental offices are open Monday through Thursday, 8 to 5. I knew what the average salary in my state was, and I knew that my work would be cleaning teeth. I was obviously familiar with that from my own dental appointments and from having shadowed during that class. After graduating dental hygiene school, I practiced clinical dental hygiene for 4.5 years. And it was during that time that I realized there were a lot of things about the career that I didn't know before I chose it. And while it wouldn't necessarily have changed my decision, I could have been better prepared. For instance, I didn't know that in dentistry, a lot of times dental hygienists and assistants aren't offered benefits such as health insurance and 401k when they work for private practices versus what is offered in corporations. If I had known that, I would have met with a financial advisor much earlier in life to make sure that all of my affairs were in line. If there were things that I wish I would have known before starting dental hygiene, I assume that it wasn't very far-fetched that other dental professionals probably had a few things they wish they would have known as well. Here at Burst, we have a community of over 26,000 dental professionals, and so I've asked that they submit responses of what they wish they would have known before starting their careers in dentistry. If you're someone who is looking to go into the dental field, either dental assisting, dental hygiene, or becoming a dentist yourself, I hope that this segment helps you to be better prepared before starting your future career.
Okay, hey guys. So I had to write things down because I had quite a few. I know I'm gonna forget. In hygiene school, no one ever told us how to clean traps. I had to learn how to clean traps. Basically, in my office now, like I had no idea we had to go and actually change traps, clean out traps, and it is gross. That's where all the saliva, all the gunk, all the things that you suction in someone's mouth, that's where it is. And it has a little filter where all the big chunks of stuff doesn't go through. So you got to clean that out, okay? That's pretty nasty. But I didn't know that until, I don't know if I'm the only one that didn't know that, but I didn't realize there's some gritty stuff besides doing some scale and root planing that I didn't know about. So
the one thing that I wish I knew going into dentistry is that how much your body can hurt. I mean, yeah, I thought that your neck can hurt and, your back and things like that. But experiencing it, it's just like, oh, well, no, I have good ergonomics. I, sit up straight, I walk straight, my shoulders are back, I have my loops, I have all that stuff. But over time, as a dental hygienist, you do a lot of repetitive work. And so it is very important that you have some self-care. Over time, your neck can start hurting, your shoulders, your back, your forearms, your wrists, your hands, all those things, it can start hurting. And so my advice to new grads is that I know that you are ready to go out there and work and make money, working 5-6 days a week. Just remember that I was there before. I was working 5-6 days a week, and I was fine for a while, but then my body just got tired, and I felt, I'm not old, why am I getting so tired? But it's just all the repetitive work. And so just make sure that you are taking care of yourself. Do your yoga stretches, do your hand stretches, take walks, take breaks, do cryotherapy. One of my favorite things to do is acupuncture, and I do acupuncture therapy maintenance every couple of months, and it helps me increase the blood flow of my body, my hands, my wrists, my neck, anywhere where I may be aching. And for me, that works. And so you need to, well, my advice is you should find something that works for you, and just keep at it so that you can maintain your longevity of your career. And so, yeah, so just remember that if you take care of your body will take care of you.
Hi, I'm Carol. I'm a 37-year practicing dental hygienist in a private practice. Before I started going into this field, I wish I knew how hard it was on my body. I wish that I knew that I needed to do my stretches regularly every day and not wait until I started to have injuries to my shoulder, my neck, my lower back. And I wish I knew that I needed to follow the technique that I was taught in school, which is the proper technique, instead of creating my own technique of bending over, looking, and not using my mirror because I prefer direct vision. And at the end of the day, everything hurts me and is sore. So that's really what I wish I knew.
All right, so one thing I wished I would have known before I became a hygienist was the amount of head, neck, and back pain that we experience. And I went for years working as a dental hygienist full-time without a loupes and a light. And if I could do that all over again, I would purchase a loupes and a light even before I graduated college. And so that's something I wish I would have known.
I wish I'd known that I needed to invest in self-care, like getting a massage, going to the chiropractor, that needed to be a priority from the very beginning, and don't wait until you get hurt to seek help.
I knew absolutely zero about dentistry or about dental hygiene. We went to the dentist once or twice a year and had our teeth cleaned. My mother had instilled from a very early age, brush and floss your teeth. But I had not chosen a career or a degree whenever I was at Oklahoma State, and I chose dental hygiene at the last minute because two friends were going to get in the program at the University of Oklahoma. I would say the hardest thing for me that I did not know about dentistry was just how much studying, how much mental stress I was going to have, because let's face it, most hygienists are a little bit on the perfectionist side. We want things done just right. And we all felt that we were pretty smart because most of us had 4.0 and above going into the program. That's how we got accepted. So I think that was why mentally it was so hard on me.
You have to stay on top of your continuing education credits. Make sure your license is active, because it ain't cheap, but you gotta pay those fees, and it's very important. So that's one thing is didn't realize how expensive school is already expensive, and it's just like paying your fees. That's just another expense that, you know, I don't want to pay it, but I have to because I want to keep my license and I want to work because I love what I do. But I live in Texas, so those who live in Texas or live in similar states that have limited responsibilities for their hygienists, for example, local anesthesia, so we can't administer that in Texas. Been fighting that for a little while. So that's something to look at for future hygienists. That's something you should really consider, is where you like, if you want to go in the field and you want to have more responsibilities, where would you like to live in order to, you know, to accomplish those goals, because certain states, certain cities are very limited on what you can do. Which is very, it's only a few, but definitely look into, you know, where you'd like to pursue this career.
The one thing that I wish I'd had learned more about right from the beginning during my education was that the dental industry is so insurance driven. And you may know exactly what you need to do for your patient. The patient's excited to get healthy, and come to find out you can't give them the best treatment because of insurance limitations based on the coupon that they have with that insurance, or the contract that their employer has with an insurance company. So it's disheartening when you know what the best treatment for your patient will be and they can't have it done because of financial restrictions or insurance limitations. So I learned a lot, and learned all the insurance codes and how to get the best coverage for patients, and how to time things out as best possible. But it's disturbing to know how expensive it can be and how insurance driven this industry is, when you're really at your heart, you're just trying to take good care of people and prevent future problems for them.
I wish I had known that no matter what you do, some patients just aren't going to get it. That you can explain it the very best of your ability, you can show them, you can give them all the tools they need, and sometimes they just either don't care or, probably just don't care. Sometimes they just don't care. And that's okay. I've figured out over the years that there's not much I can do about that, but I kind of wish I had known that up front.
You gotta figure out how do you want to be paid? You want to be paid hourly, salary, because there's some days where your patients will not show up. Sometimes they're good about calling and rescheduling, but even that, you have a block or a few blocks where you don't have a patient, and either you gotta clock out or you gotta make phone calls. Kind of like hygiene school, you had to find your own patients. Same thing. If you work in a small office like I do, I gotta call my patients and make sure they're okay, see where they are, especially now of COVID. Since COVID, I gotta reach out to my patients and see if they're wanting to come back.
Hey guys, I am going to share with you 3 things I wish I knew about dentistry before I went into my program. Okay, the first thing is that if you are a dental assistant before you go into your program, it doesn't mean you know everything. Seriously, I thought I got this. I know the tooth numbers, I know the surfaces. I can mix up some real good alginate and take a mean impression. This is going to be a walk in the park. Oh, let me tell you, the assistants, when I was in school, you were watched even more closely than if you weren't, because they knew you kind of were a little, I don't know, you might have been a little cocky, but anyways, it doesn't mean you know everything. I think it helped. I think it made me a little bit more confident would be the word I would prefer, but I wish somebody would have told me that there was a lot more to learn. The second thing is that when you are looking for a job and you're working for dentists, it's a lot like dating. I feel like online dating is such a big thing now, and you look at the profiles and then you meet the person like in real life and it's not what's on paper or the picture's different. That's what dentistry's like going to work for a dentist, right? So some you're going to work for and you're going to be like totally wooed and they're amazing and you never quit working for them. You want to work happily ever after. And then there are other ones that you'll work for and you'll be like, is this date over? Because this is awful. And I'm never going to get these hours back into my life. I'm literally thinking about some of the dentists I work for right now, talking about this. So hopefully you find your prince dentist, so to speak. But yeah, I wish somebody would have told me, there's a wide range of different personalities of dentists, and like dating, you have to find the one that works best with your personality. Last thing is really actually important. I wished I would have known more about the chain of command. I wished someone would have explained to me the value of understanding more of management in a dental office, whether it be private practice or corporate. How does the chain of command work? Who's your boss? Who's in charge? And who do you report to if you have a problem or an incident, or, you need help with, I don't know, your 401k or your pay, you want to increase in pay, like who do you speak with? Like understanding all of the things that aren't part of your job description, that aren't part of your skill set, I think is very underestimated and super important. So I wish somebody would have told me more about that and explained to me the value. So I hope those 3 things help anybody who's getting ready to go into dentistry and start out their program.
As I graduated dental hygiene school, I just automatically thought that I would find a job right away. I had clinical experience from clinic settings. And as I'm reading job positions, they want experience. Well, in my mind, I had experience. I saw patients. But that didn't count until you got your first, big girl job, if you will. So that was interesting. And also, I didn't realize that it would be difficult trying to take a vacation potentially, or just take time off if my child was sick or if I was even sick. Working in a small practice was difficult as a solo hygienist because finding coverage was extremely difficult. That may not be the case in every location, but just where I'm located, that was a challenge for sure.
But the other thing that I didn't know was that this would have been the best choice for my entire working career. 36 years later, and I can stand here and tell you, it was the best decision I ever made. Dentistry has so many options that I never knew about. There are so many things to look into that no matter where you are in your career, you can be happy, positive, and you can thrive. You can find your passion and you can go out and grab it. I hope that helps someone. Thank you for listening and have a blessed day. Bye.
Thank you for watching this segment of Burst TV. If you have any questions, please drop them in the comments below and we would love to answer that for you. Also, don't forget to subscribe to our channel as we'll be posting multiple videos a week and we hope that it will be a great resource for you.
So my ultimate I wish I would have known before, or really I wish would have existed before, was I wish Burst would have existed years ago. I wish that y'all would have been around for me all my career. How cool would that be? Y'all that are in on it at the beginning of your career, so lucky.